Now, this is the question that most of the ladies normally ask themselves. Can you stop ovulating while still young? The answer is a big yes. Now, what causes you to stop ovulating while still young? We have some reasons here. Example number one, we have hormones. Under hormones, we have some sort of hormonal changes, hormonal imbalances, and also your brain or the endocrine system might fail to coordinate well with the glands that are supposed to release those hormones. Now, it takes me to point number two, the brain function. We have some hormones that are produced by the brain, which in turn triggers the maturation of the eggs on the ovaries. And then we have specific glands. Now, the glands that are associated with the hormone production and also the menstrual cycle are also involved. But today I want to nail much on hormones. In the later videos, I'll talk about the brain function and specific glands. Now, what you need to understand is that the menstruation cycle and ovulation are interconnected, or they are related. That is to say, hormones that are released by the brain also coordinates or also contribute to the ovulation and periods. For example, we have this gonadotropin, which is released by the brain, which in turn stimulates the pituitary gland to release follicle stimulating hormone and luteinizing hormone. Now, the follicle stimulating hormone and luteinizing hormone, they help in regulating sex hormone production and also reproductive functions in both male and female. Therefore, they regulate each other glands. For example, the gonads function. We all know that the gonad are the glands that are associated with things to do with the infertility or the pregnancy, just to mention. Then, after that, the gonadotropin travels down to the ovaries. Now, when it reaches the ovaries, it triggers or it initiates the maturation of eggs. Now, there are eggs that are already in the ovaries. Now, when these eggs are already in the ovaries, the gonadotropin initiates the maturation of these eggs that are already there, and then eventually it triggers its release. Now, the release is what we now call the ovulation, or the not the ovulation, the menstruation. Now, we have some phases that I would like to brush over. Changes in the body during menstruation cycle. Now, we have the follicular phase. It takes 1 to 14 days. I'm assuming that you don't have patterns in your menstrual cycle or in your periods. It ends at 28th day and it starts on the first day. That is the normal menstruation cycle. It normally takes 28 days. Now, the first phase, you find that the follicular phase, these are the rising levels of follicular stimulation or stimulating hormone, which is caused by ovarian follicles to undergo maturation. Now, here is when the gonadotropin helps in maturation of these eggs. And then, after the maturation, there's this thing called the ovulation, which normally occurs. And remember, I mentioned about the follicle stimulating hormone and luteinizing hormone. Now, this is where they come in. Uh, Between the 12th day and 16th day, we have the luteinizing hormone surges, causing a fully matured egg to be released into the fallopian tube. Now, here is when the already matured eggs are released to the fallopian tube, and they are initiated or they are helped by this luteinizing hormone. Now, there is something you also need to understand. Normally, your ovulation takes place between the 12th and 16th day, and actually this is the period whereby you're more likely to conceive or you're more likely to be fertile. Now, here is where the fertility usually detects, and you should also understand that mostly ovulation occurs on the 14th day before the next menstrual period or the menstrual cycle. That is to say, if you normally see your menstruation on 28th day, it means on 14th day you should have your ovulation cycle occurring, and you'll be able to find some of the signs of ovulation, and it normally starts early 12th and late 16th. Now we have what we call the luteal phase. Now under luteal phase is when the raised hormones level up, thicken the endometrium. However, if there isn't fertilized egg, the endometrium prepares to shed. Now here is a period whereby we normally call someone is fertile. If the eggs are not fertilized, it means the endometrium prepares it to shed or to menstruate. That is when now you be able to see the menstruation. Now at this period, if your eggs were not fertilized, remember fertilization occurs normally here at the period of ovulation. Normally at that period is when the fertilization occurs, because that is when exactly the eggs have already matured and they are already there, or they have been released to the fallopian tube whereby the fertilization is supposed to take place. Now, if it fails to take place, it means there's something that hindered that fertilization, either the coordination of the endocrine system or your hormones are not well balanced. Therefore, the period that you're supposed to ovulate, it plays some sort of patterns which hinders that one. And then we also have what we call the menstrual phase, whereby now progesterone levels quickly withdraw, triggering the uterine lining to shed the period to begin. Now, this is the last phase whereby you now see your blood or you see your menstruation, because the progesterone levels withdraw now to trigger the uterine lining to shed and the period begin. Then what is the solution? Solution here, for example, you're having the hormonal imbalance. You can use these supplements called Feminagy. These are natural yet high quality supplements. They are non-chemicals. We call the Feminagy. We have it in our stock. So Feminagy, it helps for balancing your hormones, and then it makes sure that your hormones are well coordinated in such a way that you'll not be able to have those patterns during your periods. And remember, when you're having these patterns, these are the things that can make you not to become pregnant, or can make you not to have your normal menstruation cycle, or you'll find you're having double periods, or your days of periods are not predicted. And then number two solution, we have the cerebrain supplements. These cerebrain supplements also, we have it in our stock. It is good for brain functioning and endocrine system. Remember, the brain and the endocrine system is what coordinates or controls all the glands in your system. Now, when your brain is compromised, for example, when you're having some sort of anxiety or stress, it affects the releasing of gonadotropins, which in turn stimulates the pituitary gland to release the follicle stimulating hormone and luteinizing hormone. Therefore, we sort that issue using cerebrain supplements. And then lastly, we have femibiotics for acquisition of good bacteria and floral balance. Now, in the vagina, you have what we call the good bacteria and the bad bacteria. Now, the good bacteria helps in fighting the bad bacteria, and it also helps in fighting the acquisition of some sort of diseases, for example, the UTIs, gonorrhea, PIDs, whatever. So it helps that way, and it also helps in maintaining the vaginal pH value. Therefore, this combination of these three supplements can be able to sort out your hormonal imbalances, painful periods, things to do with double periods, things to do with ovulation cycle, or in case your ovulation stopped early. These are the supplements to use to sort out that one. Now, as you do that, your problem is already sorted. Thank you for your attention. In case you need to do any inquiries or orders to get our products, you can use the WhatsApp number is there. I've already pasted there, so you can be able to use that WhatsApp number and get your problem sorted. Normally use WhatsApp for easy assistance. Thank you for your attendance. Till next time, I'll do a video for the endocrine system to understand well the hormones that are released by the brain and how it affects your periods. Thank you.